My health, my life. Enyumekua eso yasne ene.
Ya rebia ye kwankwa wo so no. Onua tutu anamo. Na bra Endpoint Clinic. Na obenya wa yaresa ama na boso.
Ashford toothbrush. Toothbrush papa. And the Ashford toothbrush. A person and same bright.
Senya me adom amana odfo frako abeto yen de bia me ka kire menye obi anenya ne sao obi da ye awansore wo de wada adepacho watimi didi anu musio we wasan ye go aka obi ntimi anye sa enti adepacho pe na ese fatapa so de aside modu e ma twedi amponyankopon na me pacho onim se wonda na ase ya fasima baako wo de kata weni keke na kase irade medase asa we de uhia me o enti mi nja nkanda enti pese de bia muye mame so mate ase ai me da munyina ase na mamunyina akwa ba biom so ba my health my life mapomuden ene me nkwaso me den di Abigail Ashley eto da ya say diabetes na mum ene kasa afa diabetes retinopathy ho ye bisa say eden ya no so eden na de ba bi ba wa kwemu eden na obeye na wanhwe ne yi a eden na beba wo so ehunkomo na ebebo no yesi diabetes retinopathy na someone mse dwumadie nkofo bo hoka odi ba menkwaji kraton fo maboafo ho me ba de obedi enim no me na akire mo nsi enkotwa ye honkombra Ebuzama munyina akwa bebium about my health, my life. Ede asida kese pa my proud sponsors Endpoint Homeopathic Clinic. Makajo si Endpoint die ya rebia omusi omutumisa. De omutumisa ne kaka. Na wo hwehwe Endpoint mfonso a ukọ Spintex Road Shell signboard akra ha ubehu omo ho. Ukọ Kumasi nso a Kronum Obrohia Endpoint 4 ho. Afi ukọ Takrade ya Naji Estate Endpoint 4 ewo ho. Ya ediem this way chocolate drink and afi neat fufu and a special mineral water eso ebo ye chidom. Afi di asida kese pa nso ma Fibo Ventures omo no mude Ashford toothbrush eba Ghana esu di twitwi dodo mu a eyi kuku na nkaka nyina efiri ho ema na wo hwehwe mo ekiri kwa Accra Fibo Ventures ewo Kanshi afi uko Kumasi nso a Fibo Ventures ewo Odum eho enna omowo na mom sese die ba be bonkomo afa diabetes retinopathy ho na so nim se ba ye ni yare dia a hwan bi na me nkofre no nipa ba ko pe the whole Ghana ono da no I Dr. Michael Jesse or a consultant eye surgeon or sign retina specialist and afi Ghana henyina ono ye president of the Ophthalmological Society of Ghana emuye dupa dog akoba
yeah minya
official panso
afin come
ma feel it's all for me so the bia na we surgery na kra nyanya mi adomanka odwane jawe
me kwa na me fuda
yeah that's dog ya diabetes na say the thing say diabetes retinopathy den
abi we dia ye be fa YouTube every day so ada atiefo na o ma ye hwe ne ekoso nyina enne na ye ka diabetes yenhwe diabetes na kaza what is diabetes na diabetes here obi asebi ana yadi bi asebi e ma esichire edoso ye mojemo enam se either say ye produce enough insulin and na say you produce enough insulin, but insulin ain't meaning a juma, saying SSA a year. In team pain pube, yes, your type 1 diabetes, such as a only no on produce enough insulin, I burn a juma.
Insulin near adding.
Insulin near homo beer, and I just say, Union, I just say a boa emma a citri, a round namona a year a juma. eno ne insulin na saa ne wo type 2 a mo insulin de bi wo ho ana toda isa na ne ono intimi nwura honam no na aye na dwuma tinimie nyina ne koba nyina ne se ema esikyire edoso e omujanom na ebasa ese enoma bebre eti yenhwe ani ankasa se ne yeni etie mpempia me pese me de kyerɛ na se yeni ye adie bia moja efam bebre moja bebre fam every second intino diabetes sebi esikyire ewo ye moja mu ewo effect bebre ewo ye ni ho na ohwɛ se ani ye kramia ne namu infinfin sebi aye yellow eno ne retina ye ka ho semi na retina na moja esapani bebre kokoni ye moja edi oxygen eni aduane eni bibia eni
ye di mfuni na to screen see na nko function yi
enti kokono arteries edi moja ekọ eninu na ne sebi aye blue no veins edi moja free eninu na say retina sebi cells edidi na say unya diabetic retinopathy and ye kire nyina ne say retina no enam esikyira ewura ne moja ntimu no asai retina no ama retina enye na dwuma se ne esese eye na ano bi person se na kwan beso na efa ese no se ne tense ohu moja we akese kakra ba ekonanim divided into smaller pieces arteries no ye na fedru ne fa ne capillaries into sa areas see enam se moja ntina se no etoda na moja ntino as well anasa ahono na ebasa enam sa ahonti no nsuo asebi namuja mu efra muja nam no eliki
te said ye was screen so
ebi na ohui nsuo eliki efimu na nsuo liki koko gina efra say babia di hu ade na ye fa ne macula no te basa unya bibia fa ne macula edema just eho aswele sana se photo on sanfa photo back no
me pacho ye hwe photo back da mu yi ne sesiara
sana sradie se bi muja sradie ewum so edidi nyina sradie ewum sana yellow na ho no eye sradie I find lipids and as hard as it is I know so a leaky a free moja team akwa retina mu na the same way na enam say your friend is retina no ahohon na aswel ne wo no so at birth intetoda eno so pai as a pai na moja so ehwie go retina
as a pompo bi ahohon na pai okay
intubo say ensuo efri moja ntimu stradie efri moja ntimu na moja enso efri moja ntimu
na nyina na moja
na nyina ese retina ese nisiko na etoda so say enye leakage nkwa na esi leakage ikoso no enam say etoda so moja ntina nkasa e block send the toda better so be stroke the mojantia block and no mojantin to me block ne block one kit one more na say baby I was moja ekono na de oxygen ne aduane kon enye bi enti enino bom modern say obe solve sa problem yi na as part of new vessels as part of new vessels enti say ba ko de buy no so hwe ya bo na baby mojantin kidinkiti bi e wo baby
obi de na paisa no
we bibi etesa
okay
bibi etesa new vessel C bus a new vessel C a very fragile into a bleedy as a bleedy once a mamoja if you go gel na sebia wo yanimu no so we twa odwan mu da na sa ponche no so there mantan bia mama bi wo and it was gel into moja e ko tie gel mu the gel asebia nka wo hankete se insuo crogin se entesa and am se moja akwa fra we na ne kutwa ginyina ne se ma eni no enye dwuma se ne seseye na ehuna de se ne sese ehun de diabetic retinopathy che se retina sebi enam esi chire dodo wo ye moja munti aseye ene diabetic retinopathy
na person bi se o ka esi chire na se na person bi se eye esi chire ye digu eduane mu a ye di ene kota ho ana esi chire fifa
pimpi etoda okanda bitu obi afisa sichiredi na nyina Africa carbohydrate carbohydrate udi carbohydrate sebi ode fa wonum ekofa woyem na a digest na say emu pai na ne twaje nyina end product of every carbohydrate metabolism eye asichire glucose.
It's uka carbohydrates say benku,
fufu,
bayre, gari, brodo. Okay.
Now will end up with glucose. Now, if you can't asichire, say be glucose near come wasem. Then you say asichire, say near water sugar or want.
How do you go?
And now we carbohydrates. Into now edani glucose. Into glucose need true and asema yeka. And you say asichire they go yem no na say be a wasem yeka. Na the end product are glucose. And na it causes no many na.
And she said, "Oh, she said, obinya diabetes and you say diabetes no kuana when you one shini year. I bet me ako faster diabetes retinopathy ya kind.
Be na ohwe omo was say type 1 diabetes by 20 years na be was significant retinopathies. Omo what type 2 I say be type 2 the anka him say anka anonya shakasi be type 1 but omo kra no in 20 years time na be 60% or retinopathy. Nti near China say once a diabetes no wo ho no e be say any no. Nti yen cancer so say e be den na say bi and say risk factors be na e wo mu etimi ma diabetes say any e okwen. One most important one a type of diabetes awo. Na type of diabetes is or type 1 and we share sentem. So and insulin say be ni hokra na say kiti nti ma your friend is saying glucose e wo moja no kasi bebre echi obi ase be type 2 nti say and as I cause retinopathy in 10 a chain type 2. The other one is duration. And I'm say diabetes here the chronic disease and ya dia say be unyane aka say o wasa and people betu be so me diabetes ya mama adrobi eso atu ana ase atu no do na chronic disease ewo ho
diabetes intimi to ase
so far in ready manina we manage diabetes.
Sir?
We treat diabetes. Yeah, maybe.
Before we drill this only announcement be
yet there be uses for mo catch na jamu na mo kan ye o ba ye ho ya diabetes ye be more diabetic doctor na endocrinologist or be so na dodo na obe treat sa na utbi treat so anu ya sa retinopathy be brain no emba so na we na so free ho ye wo ye friend saying ya dia se bi wo honanu mu ankasa I no so cause sanoma ina ma diabetes worse even so hypertension or diabetes and hypertension so SM mugenti ya diabetes say no tietesa e ma ecostro
so we are cousins
we na focus
diabetes na hypertension we are cousins
pa
we are watching you know papa ko so
it's hypertension and so at the beba
okay
o nyensanya e ma diabetes sugar levels e change bebre anyensan e de sanoma nyina eba nti we nyina free mo obi asabi owo cholesterol e woni hunam na say lipids e wo hyperlipidemia na hypercholesterolemia nyina e we fat again sanoma nyina ese mojentimo obi asabi owo kidney failure so diabetes e be person be hweso yie kese pa and I say nyina kabomwa e say e cause retinopathy and tentem pa.
Okay. Doc, ye buy kakra. Who can find the causes of diabetes retinopathy no? Who can say mbojana idna akopai na akos. But per se, apart from diabetes no, be any where it may causes diabetes retinopathy. Just when you diabetes.
A change say your retinopathy be brain.
Okay.
Your sickle cell retinopathy. Okay. Your hypertensive retinopathy. Okay. And your diabetic retinopathy. Ne can retinopathy just a retina say be oyare. It's your yade be brain. It's
depending on what is causing
it. I shame why it me hu. You share any way to say a dear me features a woman say diabetes na air cause sad way. And I say send mujentia me baby mujentin distribution war and it say a bleed da me hu na ase ha no esem say a sickle cell and a cause way. And na so hwe animo wodu say bujantintin sene ebia ya kitenkete ebia ya white no ne essential hypertension and na ekoso the retinopathy in the nase chiri na say retina sabi oyare na ne yade no bebrebe and na wo ho
nti e ko hospital na doctor e hwe ni ne so o hwekeke onim de nti o hwe ni no onim okay na ye hwe symptoms bi wo ho ba ubehu ana eno ane se ohwa na ya kase when diabetes retinopathy ana bibi nsencheni bi ohwa be yi ne hu edi ansa wa hu sei baby anyama ekoyi unya nya bi anya unya nya bi
ye first diabetes sebi enya retinopathy kwana ekọ so normal bebre I free woni cornea ekwa kosi na chiri ho se yen limit ye ho to retinopathy. Retinopathy it starts as a very subtle disease. Just say kitikiti a unhu hwe dodo na unhu hwe moje ya ye so hwe ya ubo se moja bebre ne apane ne leak no ejina babia leak egwansa na akoso ambo ho na se eni no nye ni ina ne di ho ade edi mfimfin kakra bi macular area on ne di ho ade enti se moja na se bia hwe ego retina num ha wesi on babia se o hwe yellow na o straw na se kakra babia se spot bi wono edo ne macular area hono eno ne di ho ade eti moja ya se bia wo chire ho baby dodo na wo ho hwe se ayo bibia nti symptomless at this stage so
unte she woni nso nya she nti na time bia so ahwa oko hospital time bia doctor behwe woni achi nurse kra behwe woni achi na say exactly ye hwa se bibi wo ho a ye behu ni aso ano ntem ansa na se bi akoye ne ho bibibi so nti sanity nti so hwe babia photo na ba mo na baby nso as a friend say fat be a ben's area ho na e ben no a na problem no start there you begin to see say bibi so na e ben no
pepe we say o hwe baby a ben no na say ni pay obenya symptoms as na ni ehuna de kese and as o hwe lines as lines na change kakra so at this stage no be hu say bibi AC na dodo na sebi ema patient no ohuna de ebia na ete na say diabetes affect lens no so ema ete into ye to da be okan so ema blurry vision wo na say ete no esesa cornea timi ya edema to so na say ensure timi ra cornea no enu be timi say cornea no animu ifen epithelium itimi why healing terminal diabetes is normal across wani num so na retina na ankasa ada say modentinti no aswelling kitinkiti unhu hwe ana say leaky fluid kitinkiti ewo achiri unhu hwe ba ben finfin ho na uhu ehona bonsa ovation ecoform ana say lines enye straight be emma na near titro ehia yen as retina specialist any say unchai emas hamujentin titu nuance na form no empire na enfie muja enhu e furniture gel num say ebasa suddenly you lose vision.
Wow,
you lose sudden vision because gel na clear no e muja kofra until light enfam bio e do stage na ya sembre e maintin pepi no ai pese ye hu sanu manyina tentem na yeso ano na ye wakwan bibria ye de so ano se ankobasa na se enye hwegu geli mu a two things are retina specialist beye ye be hwe ni mu kakra hwe se e be settle down san settle down na ehia se be ko akoyi mu je na frechire there na che ye drew operation kase mu vitrectomy na vitrectomy surgery se bi ne bo edin kakra ene hia fidi akase bebre ahanti ye bo modern se ye drew stage ya anka better ban pimpin no ye drew hopa.
Okay doc me betwa ye ho akwa ba na ye si krom na ebisa amafo say eja diabetes retinopathy ni din kakrakai what be da na utse sen na onim bibi kakra fa ho ana ma enkoti nkofo no musa me ba ma we bisa doc say eba de say ya den na wo say woye is me bisa say nkofo diabetes retinopathy no o mate da na ye kombra.
Retinopathy minim sala bito na minim sa bibu ha ka twa so friend retinopathy minim biwa minya doctor minim say yes diabetes mu asichi ya den sa but say you ni ana say you dey minim the other one why we hu ya woni o de bebre asichire especially me to me ni boni aduane enye Ghana aduane me kwa aduane na say boni de me maje me de me ni boni aduane ntino on te me to manyini pa me 65 plus but bibia ntumi me kai me kofia me tumi do me fifi me fie na me do me bibia ba me nko hospital da e na dodo no anso no Ghana ye ho anhwe dodo no no se gina aduane ayedie no ntimi hwe maduane ye broni bi ka je me say Africans no see di aduane am ke nyare nti won no mafa o kan about 10 years no kan mafa na me there me di aduane ntimi no me di
retinopathy maintain that vet me dey kan mi say bia koko timi ye wani ana say ete etimi si wani so na sa diabetes retinopathy no maintain that
what is diabetes retinopathy
diabetes retinopathy. No, I don't have any idea about it. Meaning diabetes, but I don't have any idea about say yeni.
Who diabetes retinopathy no nim de ba. Enye doctor na kai a when wa chika kregu utuma nka wunim. Anka wunim when I was shrink for. Doc, there was somebody poor.
Was sompa kase.
Public health education.
No any problem. Gap na ho na wo.
I thought I meant here. Anyway, into the UTV,
exactly.
Ya wuni munina ya bebo modian say in saduka a doctor for ne dia e betro was here into na ya tun safre Dr. Michael Jesse, specialist more or a president of Ophthalmological Society of Ghana. Just say and Nino just a consultants ni be a feni dia obwa. Want me found China and ask or not to me quibridge, it's me very free Ghana. No quibridge. No call you be operation, no as number back. I guys said Jiraba. Dog.
Abi.
What's your mo?
Miti. Ayasam. Ba unim near FNS and as a Dennis Sebi UTV Indian Maya Bodero. So na so bit mobitimia canamuni and marke. Obia besumia beboka krakakra anka man for better ne diabetes nkwa no be brio yo look glaucoma mwaka baso obia so besuma no bia kakakrakakra
no de bobwa
no HIV by na sabi aban so mu a mass media so mu yi ewe hu effect nya it dipped. These are the areas we are talking about. Say mass media and Zoom as a social intervention. I don't think it costs that much. It gets people glued to your stations. So idea be sebi okase Ministry of Health and enya sikano eni ho. So is the private sector that should take up some of these issues. Trust me, anke be effect. Omo diabetes na be say also more cost screening. So omo glaucoma na be say also more cost check.
Doctors no more obia busy. We say no kwala na me na Roma. Owo ka say ka wo go surgery ja.
Me consult
it is sometimes so the platform is there, but getting the specialists to come and talk about it is the issue. Okay, back to our topic. Diabetes retinopathy. Treatments or
treatment.
It's
so na one early detection. Na treatment diabetes is one area and treatment are advancing be brave. Glaucoma. Glaucoma they say go so brave. Now diabetes treatment are very effective. And I've said see hunin temwa. There are stages how you decide to say you be treat and as you be share anymore. So Kasa me catch yourself, some jacket if you go to baby, I watch your baby and share that and ye shake and as a new reasons been and ye shake. But say a ben fin and I say in your ben fin a bad effect vision there he say you be treaty. Now first since the technology about baby it miss canning retina, it miss canning who baby ensure a tie and as a moja
the eye scanner.
Yes, scanner be braces, a laser scanner, say best scan it through. Say, and can I come to a B scanner now? Say, a OT scanner, just ultrasound, and your laser scans be brave. I be organa, I just scanning retina, no, a whom baby ensure a war, baby a moja a shegu, baby a moja a war, and your son will laser side treatment. It's new imagine say a be hun in ten. Now say be in 15 wedding hunadi and na. nsuo enyugu ho a ye wo laser treatment a ɔse ye anna say wo injections a ye de wo aninum ye dry nsuo yi se mogentina eba ye injections e de ma na ye dry mogentino it is a very effective treatment diabetes for na ni na ekosi abording so
the body national health india
omuntria na yemfa ne say time on national health eba so no sabe na injections nyan duru ha so injection started as Fraser Bagana maybe about 5 years ago. National Health 2005. Inti achibebre. Sabeni intro na akase they will probably reach out to some of these new treatments. The nebona dintino etoda na it will dry national health coffers no so intino and pay for health economics we are careful as to what you want to take and what you don't want to take. Yeah, the other ones so the first line of treatment these days injections the one dry almost every aspect of diabetes say ensure na leaky free more dry no say mugentin na if we say if free
dry diabetes ne fe ni pe and now the whole body
okay we the war aninum so there are different types of agents I will say and they're in the country dry no only said do one no work for only 1 month. After 1 month no na insulin started by and I said diabetes no ho enjoy so after 1 month na started nipa bebre no ombe was ache only said to that be spacing in your bed 2 months and 3 months exactly but ebe cause and na year why we na so it mean monitor ho say na esia dry akosi so say a dry completely bia na jai ahwe ni mu kakra say san start bia na bia ya wo no and I say omu an ya wo any one aspect of treatment. The other one a laser treatment and they are also very effective depending on where the edema is. We can dry it up completely with laser. So now when anye ya na say mugentin start to say if free na say a dose be brea and pimpi no e wo periphery ho a e say ye di laser essay and say photo be by na na laser treatment or my no any so entire person ye dry ye di laser essay retina ni nyina and we shall say essay retina no na ye jam finfin kakra na odi hu ade no na se nye retina ni nyina na di hu ade na so hwe photo na so mujanti na ko ba bia it ba bia oxygen ba bia nutrients ba bia micronutrients abra enshara nya djuma kese bia enti ye be pese be say area ho nyina selectively ye selective areas no nya destroy ni nyina with laser light so na ye jam finfin enti moja na ba ni nyane kakra ne ebi ni ha no hu nya laser spots. Okay. Exactly, we PRP, what we call pan retina photocoagulation. And you shed deliberately and laser all these finfin kakrana. So exactly, because finfin di hu ade. No aduane eba isa, oxygen eba isa. Nya kebia enyusu mfanya hwe e gese no kwa ntia seni na ne gem finfin no so edi hu ade se ben na enin be healthy and it works. On number 2 baby omo destroy no areas be brave obi hu senka e ben a bo se new blood vessels e wo ho and sa blood vessels na yekuno so we dry them up intenya de be bleed bio na e de mojaba gel no so this is a very effective treatment yeta your retina clinics be brave either say a focal laser and me area kakra bia was a moja ehwegua e ben a ifis a bet threaten a vision no na honkwa the laser kakra bia and me say we laser spots me isusa and it's very focal in that area and honkwa near dry area or up but say kobaze bujenti baby be brave then we selectively destroy all these areas and leave a central macula out in hunadie. Inti treatment.
Now, doc, but it say, doctor, I diagnose you say, oh, diabetes retinopathy. Na ebia, oshe treatment na ebe mana unisika o de be. Ede beba.
Habi omaya team sebi obia nim say your friend is saying. National health and to me amphibia and you say amphibia and to me amphibia and you know healthcare should be anybody laser swan maker one laser unit for $33,000 most laser units are about that yes putting laser they are not cheap yeah these are retinal laser about $33,000 other lasers are why be $250,000 so ebi ne ye friend saying opa and then the retinal surgery nankasa vitrectomy machine about $105,000 constellation ne bono no na said the fide ne bon kwa na hardware na consumables ne use let's identify that use consumables bi onya to wi awato na retinal surgery machines no enti impempi no to da ne ye ne say your friend is saying ye bekra ye be your partner St. Thomas Hitro your retinal surgeries be brave next month starting 17th to 3rd March we are doing free retinal surgeries
and na ma becha no ma becha
the be also about
the company ma becha
free retinal surgeries now we try to look for partners outside the country now St. Thomas and Tufts University or Boston and New England Medical Center your partnership every year biano almost 2 doctors eba and Arcon a supply on free materials into no ebasa surgeries be brave free and as your tissue be brave na your selected patients no so here here for na yama wo so here for pa out say go go list so omuntimi ntwa and am say nya
obi o mo aba ho
aba mo go list omuntimi
okay and say akam baji announcement ama me forces ya
Debbie yes select one retina surgery
hospital no municipal
and your cra the penipa number and as a surgeon time no free consumables are eba free nti nyaka machine ye de ma and building ye de ma legal grounds ye de ma nurses ye de ma other consumables energy water these are bills are symptoms so any insurance BBC so these are bills are but if it's a way in so important say no business so obia wo nisika say be ediana ye emano so these are some of the ways I say be itimi keep your home as Ghanaians going and I say obia ni ho obetwa retina operation amount sanity ntino kakra mpisa sana etie na retina surgery dey na body pass be
nti wo baby na wanya sa free way ni bi ana wo nso wo ni sika o de be na chese woni ni fra na efra
abianya no nko ana wo ho ya de be bre wo ho a se bi unni sika ekosa uhia operation yesu uhia cesarean section unni sika By hospital crying to me free Emma because there are running costs to be picked. So yes, so pneumonia, ube here extras and doctor unisika ekaho. Well, wouldn't kidney failure for be brave or Ghana or access to care. Exactly. So that is somehow that's where we have reached as a country. But we all hope say yakoye nimka kranga krano. Sebi economy improve exactly normal basis a check but you be anything
okay dog e be hwe se betu ya boy ho ban ya e bi nya nto yen no e be hwe se be boy ho ban na ya e bi ato yen so doctor betu yen fo na mum de bia me ka se jumedi nkofo bo hoka ma me koji ka to fe ma boafo me ba wa wonye bia otifie efutu be na doctor de be ma nti ye waso ye wa wunya nya bi yen so prepare yourself also beje we food and see try on compra no ma message kakra Damunya system that so emotion my health my life my pomodin enemy kwa ewo United Television so me da seda kese pa me proud sponsors Endpoint Homeopathic Clinic makajo say yare bia omutumisa apart from kaka na we show mo a omo Spintex Road Shell Signboard uko Kumasi Konuma Brohia omo ho afensu uko Anaji Estate ewo Takradia Endpoint 4 after just dance this way chocolate drink ya ediemu and neat fufu and a special ice mineral water me sound so the asida kese pa Emma Fibo Ventures omo no mo the Ashford toothbrush aba Ghana you see you would do dom who choose na just say etumi in the car na just say baby akokaka baby a eyi epie wo hwe Fibo Ventures akra ha omo wo okanshi afi okokumasi a Fibo Ventures ewo edum I ho eno mo ho. Dr. Michael Jesse Edaswo Minchen our studio ha na ono ye president of Ophthalmological Society of Ghana. Dog ye ko break na maybe say obi a onya diabetes retinopathy. Efutu be na de be mano.
Abi ni nyina twaje
or
diabetes a bohun ban se unya retinopathy.
Okay.
Retinopathy e di ntineba e balance asiche no gusu o mugem. Asiche no efa wanimu, na asiche no sai mujantin. Enti one ene se obebɔ mod se obehwe diabetes suye. Na asiche no wo from 10 bia. And that's crucial because hey, una se obeba eye doctor ho yebe we say yan control esichire na ebesan say
the source
is say esichire omogen na efa mogen team na esay no enti no the key element na say obehwe wasichire suye enti etwaje say obehu physician specialist and na say endocrinologist or hwe ye say be doctor was specialize wo diabetes and say endocrine diseases so na omondos wo Ghana enti physician specialist say okay when ya general doctor okay amount ni hian say sugar na ebewofo na omo wo enoma bebre a omo so emesha na omo noma bebre a ye be recommend ya ma a diet account in no different types no yi ntiam say ehona eyini na wo na enam say ye nim so say diabetes over duration so a risk factor so despite the fact that all control diabetes or more software we na anase sebi yenuanom physicians are almost diabetes no at least after 5 years bia no for type 2 omo refer ni show money omo access omo share omo check yes omo check no check na so who sense sai kakra ba obere fail once enya bedu yensem no then the whole issue is how much damage is there in the eye, where is the damage, does it warrant treatment? Say he has a bit treated and he has a bit treated. Bibre no a bay observation kwa. Yeah, bibre ni observe. Say na make baby moja na go.
It depends. Yeah.
Bibre ni observation and glycemic control. So we send a message back to your doctor to tighten your control. Now say e ba ni mu bibre say e be tight when in baby adi hu adia. E hona na e treatments ashase. Your best cancer or see you be careful to so see na ye be angiogram or see na bibre it me the die egu uramoja na akọ flow when me homogen team ya say near and say and na then we decide on two things, laser treatment or injections or both. So say injections we start the injection and then monitor it. Say laser we start it and then monitor it. Say a bros na say moja na ehwegu gel no ehwe anymore. Say a bit clear and say clear. Unclear and just persistent. I see a day again. I see a quite gel if you not a retina surgery. See a gel and I say retina baby a picture and I say Mugentina a twin retinal a tino a cause of detachment and a retina breaks. It's a the beer and say Mugentino a dry up it with tino and now say a new movie no and I say if free retina also a bad gel the gel movie it with tino sir it is a tina or see a retina detachment surgery into a complex procedure so na nyen pen say be Mugentino be one much be now forming membranes be or retina no a mass surgery to me deep by 3 hours. You be peel membranes in your lasers be brave as well nastal vision and recover be brave. And in pain pino I be penny say be you be so ano a chance say you be treated. So it me so ano you penny say be brave chance a best say we na operation be treating.
Dong me patch me fa messages kakra na en to as ma mendi kan call ko for Iri and ko for Isaac dear. Isaac say obisa say diabetes retinopathy no it me affect ini ba ko ana any mienu ni nyina
in pain because a systemic disease no when mienu net affect no but in pain be brains is symmetrical and yes say enam say wa handi chinchina e wa ha and I say wa ha kakra na ha hya se kra and wa ha bebre na ha hya se kakra ana e woni mienu bebre nti no it me esitan
nana ya ebisa question bi o say doggy oda wasem na mum obeso bisa say yeni no how often can one have the examination What we call a hospital be an say check him out.
Again, that's very good. That's a good point. Yeah. What we call hospital be say open say check well him because not be brave or ho. Mpem be attend UTV video so can glaucoma and send be brave. Glaucoma any symptoms be and bon kaye. Into obia timiko and you know so my team glaucoma wo kase pa. Do timiko doctor say me ba check up. Ipa be brave eba say me be general eye check up. So and no doctor be check bibi obe check pressure ma obe dilate weni obe hwe weni na chi ehun se nsesai nkaibo bi wo ho a ebe se ni no a se eye glaucoma and e bon kaye e my warning and as a diabetes na my warning and as a sickle cell and all other kinds of diseases say ni no ehun ohwe mo ani ohwe mo yeah any trainer specialist will say it but the next thing is we never ni refer ko say and as a winner enti no obia timi culture habit say periodically be ko akohwe yenia anka bebo bebre na say o diabetes ne hwe and as say how many times you come depends on what is there to be or higher more 1 year review so every year brand review and no say no ba ye hwe say new developments bemu ana say ben macular area ho ana say bibia te sa be ma ya treatment in time and I say you're back still. So we keep monitoring until things get worse. And they give feedback to your doctor. So we sugar no more tighten or you making sure say and I say a year worse or what in the insanity.
Mami ko soon ko fa Linda tete dear. Oh besides say I see no diabetes. And see no chance on so benya side diabetes retinopathy nana.
Catch Linda say ya can be brave and duration one risk factor, control of the sugar, one risk factor, type of diabetes, one. These are 3 major risk factors. And
so, people me our diabetes, then so on your diabetes retinopathy.
Be you're taking baby, 30 years, nothing. So, and a be so less than 5-10 years, and Nina say complete. And Nina is in the on money doctor and share message so. Say instructions and the doctor the manual on this 3 year now on making sure the time you are checking a situation our form.
Okay. Airports West Mr. say where they ask the text message minimum bakwa I saw that as a part with this education na omunim omwetriba any fry h3 and I catch almost say diabetes retinopathy. I think I know this. Mr. say, and see, or that has to say, yeah, UTV for Yabomodi, yeah, church and Uncle Fontia, see ye. I told you, no money, I know, be a full say, a been a fetch, been now to a drew be a year, near me be. No mum, Yatia says a medical condition, and then in a spiritual, got a for a spiritual.
I don't not counting on my hospital sometime, and I see me see now to drew and I mean, waha. There are major barriers.
Okay.
So, and I'm sorry.
Now, mommy, for last question, we count. Obisu bisa say, doctors from Kissiman, or see, sir, diabetes retinopathy way, herbal medicine or what to me sana.
Doctors, me meti here sebi, me ubruni doctor. Na have no man no me nibi, and just a min cancer, and I'm say. Sebi your whole research center or mampom can US is some herbal medicine it me gire sebi bisa e wo ho we say enya madesua and I say madechre na say yan chre mo school sir
dog enti ye kono ya time aso ye krakra den opposite catch Ghana for ansana ya sorry so
ne ye di beja tifo ina ne omo ahwe afide ina ne say sebi o diabetes mo modern na di ne o doctor say yeso mo modern be brave say diabetes not doing a dear man say ya sure sebos me bia bra bomodi nako so hypertension is treating na bomodi net treaty say utimi ediso pepe na say sugar no from 10 bia retinopathy either say emma and say ebeche bebre ansa na ba and say ebeba kra na e from bebre and say retinopathy ifra any na no operation ye kra na sabena equachi yam prevent say ebeba ni aba treatment she the veggie for no
yeah that's papa we dey beja no akọ to oyi o surgery
That's
Doc,
Mitchell.
Very good. Dr. Penta Major Niaka. It was Major Dr. Michael Jesse Anemo Ada. Munina asese musumo hwe ne yeso ahwefo anemu na meda doctor ase doctor consultant eye surgeon or sign retina specialist or science president of the Ophthalmological Society of Ghana or sans ejuma was St Thomas Hospital ewo Mataheko and or sans ejuma ewo Emmanuel Eye Clinic ewo East Lagos wo say the hwe ya papa na nso ne wa bombodin pa abboy ewo studio with the discussion on diabetes retinopathy mesie bi enti mesomehya mosem de wo sie nyina wo de behwe okotodwe na wo so abo ho ban wonim se wo diabetes amepa cho edura ede ma ono fa we duro no de aduane ne so pepepe memma wo sugar na mbro so yesa e ba kofa yare foforo abramo ye da munyina asese na mutum hwe na mu ma me fast da kese pa e ma me proud sponsors and points of Diabetic clinic me so omo shell signboard omo kumase krunu mabrohia uko anaji estate takrade nso a omo ho afei so me da aseda kese pa e ma this way chocolate drink someone me mixing no and one stay in sushi when you sushi when you wheat bread and dandelion leaves kakra wom what you see when you tomatoes kakra jene kakra nkosia no de nua men di ni na o de for half per count kabrodo na onum this way negoso so what you see no afenso meat fufu me penny rere nkwan pa square papa me da seda kese so ma Fibo Ventures for enomode ash Ford toothbrush aba Ghana almost see omo boy na etwitwi edodo mu yiye nkofo ntwitwi ho yiye o kasape na sense abafo ni so in the Fibo Ventures brush no o de twitwi se to mitwitwi dodom etwitwi tekrama so yiye na wo hwehwe Fibo Ventures o call kan share omo ho wo kuma se edum so a Fibo Ventures e wo ho e de besi a na mom kai se my health my life my pomodin enemy kwa midin dia Abigail Ashley doko inti die it's true bye bye
are we good
yeah yeah mene wo doctor fine maba tell a friend to tell a friend Jami the body and come up and trapper my health all my life Mean quite my pomodin, my health, oh my life, oh my pomodin, mean quite my health, oh my life. Mean quite my pomodin, my health, oh my life. My pomodin, mean quite me no doctor, feel the mother. Tell a friend to tell a friend, give me the body and come up and trap up, baby. I'm so sorry, Tintini won't come. Do you wanna learn more? And I get ready, cause it's all about you. My health, all my life, oh. Mean quite my pomodin, my health, all my life, oh. My pomodin, mean quite my health, all my life. Mean quite my pomodin, my health, all my life. My pomodin, mean quite, about you, family, on your TV.